Hello, I'm Brook Ward. I'm the President CEO of the Washington Health System. I want to take a few moments today and answer some questions we've received recently about the coronavirus and its impact on healthcare and the Washington Health System. The first question we received is, how has the governor's mandate on shutting down essential services and non-emergent healthcare services impacted our patients and our community? And the short answer is it's pretty simple. It's impacted us greatly. Over half of our departments and services are either shut down or essentially shut down, meaning they're doing very few cases. And it's impacted those patients who need those services. But those patients and we are doing our part at this point in history to try and reduce the curve in the fight against coronavirus. In addition to that, any organization who receives a large amount of their revenue, in our case almost 50% from those outpatient procedures, would be impacted when they get turned off. And so we're struggling with not only the response to the coronavirus, but the financial impact as well. That leads into our second question we received recently, which was in response to the Observer Reporter article recently about layoffs. People were asking us, why would we reduce hours for employees, lay people off during a time when we should be ramping up for the response to a surge in coronavirus patients? That's a more difficult question to answer. And we and all other healthcare organizations in this area are really fighting two conflicting priorities. One is to ramp up and be ready for a surge in patients from the coronavirus, and how do we handle and deal with that, while at the same time dealing with the financial distress that we're all under now, with most of our revenue on the outpatient side disappearing. So the way we've decided to tackle that, like many other organizations in this area, is to try and reduce hours and expenses, and in some cases, small 1 to 2 week layoffs for employees in those departments that were impacted by the shutdown of services. Now you might ask, why would we lay people off that we could use during a surge of the pandemic? And the short answer is we're not doing that. So we're not doing any layoffs in the ED, the ICU, or in our inpatient floors, or other support departments that are needed to help take care of patients in those areas. And then all those departments that had closure or shutdown, we did an inventory of every staff member who worked in that area to find out if they had prior experience in the ICU, ED, or the inpatient. And if they did, we're trying to get them retrained to work back in that area when we have a surge. So the folks that were impacted, and it's unfortunate they were impacted, we all feel bad about that. Those are folks that can't go back into sort of a nursing role, an ICU role, or on an inpatient floor. We may have to call them back if we need an extra pair of hands during the surge, but they can't do some of the jobs we would need during a surge of coronavirus patients. So unfortunately, we did have to make that tough decision. And the bottom line here is we're trying to respond to the governor's mandate and his expectations and do our part, but do it in a way that is responsible, not only for the community and caring for them in the surge, but also financially. The second question we've been getting is, have other local healthcare organizations done the same? And that's an easy answer. Yes, they've all done the same thing. Some of them are calling layoffs, some furloughs, some reduced hours. They're using different terms and phrases for the exact same thing we did. And some, frankly, have cut deeper than we have. The next question then is, what does this mean for the Washington Health System's future financially and both from a service perspective? And I wish I had a great answer here, and I don't think anyone really knows. But what I can tell you is we've done some financial modeling looking at the impact of those shutdown services and the extra expenses we're incurring right now as we buy and purchase equipment and supplies to respond to the coronavirus situation. And we know from those projections that it's going to be a financial hit to the organization, an extremely hard financial hit. And so we need to make sure that we do things that are important, smart, and wise in this period of time. So unfortunately, we did have to make some of those tough decisions to reduce hours and lay some folks off, again, in 1 and 2 week periods. And we'll have to reassess every week. Do we need those folks back now? Or do we need to keep them off another week? With the intention of bringing everyone back when life returns to normal. The next question we've been getting quite frequently is, do we need donations of personal protective equipment, money, homemade masks, and food? And so I want to address all those individually. Let's start with personal protective equipment. But really, we need donations for all of those things. But with personal protective equipment, we're buying those items as quickly as possible from all our prior vendors and new vendors we've never had a relationship with. Some of those are coming through, and some of those can't deliver because of the high demand and need, and in some cases, direction from the government to send it elsewhere. So we're doing the best we can to buy as much of that as possible, because our ultimate goal is to make sure that while we're taking care of the patients in our community, we're taking care of our employees and our team members to make sure they're safe. And we've been making decisions around PPE day by day, minute by minute, depending on what the situation is now in our environment and how many supplies of personal protective equipment we have. So for example, just this week, we decided to have all patient-facing employees and team members who are not dealing with an isolation patient to wear a surgical mask and eye protection at all times. That's in order to try and protect them if they're interacting with someone who's asymptomatic but coronavirus positive. So by upping our game and having those employees wear that, plus the personal protective equipment we're dealing with and using for coronavirus patients, you can imagine we're burning through personal protective equipment faster than ever before. So any donation you can supply, provide, is appreciated, and we're grateful for it. And we have been getting it from numerous people and companies, and I'm thankful each and every one of those. That helps supplement our supplies. And as you can imagine, in a time like that, when we try and buy supplies when we can find it, we used to be able to buy an N95 mask for 59 cents each. Now we're getting quotes of $2, $3, even up to $7 and $8 per mask. And so any donation helps, including financial. We've had dozens, maybe over 100, I haven't counted, donate just in the last week or two alone through our Facebook page, through our website, by sending in checks and cash. And we're extremely grateful. All of that money will go towards helping fight COVID-19 and protecting our employees. The next donation item people have been asking about is whether or not they should donate food. And this is a more complicated question, and you might not think it is. And surprisingly, it's sort of a logistical issue for us that deal with during a crisis like coronavirus. And so the issue we're having is you have to remember we have over 2,000 employees working 24 hours a day at over 30 locations. So trying to get hot food out to those folks while we're dealing with everything else going on in the environment can be tough. So if you want to donate food and you're adamant about it, I'd encourage you to contact the Washington Health System Foundation, talk to them about a donation of food. Instead of hot food, consider donating a box lunch or non-perishable items and snacks that we can get to the employees at the right time in the right location when they need it, versus trying to handle delivery of pizzas or something like that to all of those locations and sites. And then the last question around donations is homemade cloth masks. A lot of people have asked, should they make them and deliver and drop them off? And the short answer is yes, we're taking all of them now. We're going to use those for the non-patient facing employees to provide some level of protection to them in this environment to try and keep them safe as well. And we'll be distributing those to those masks to our employees as quickly as possible. So at this point, I just want to thank you for your time and attention. I hope this was informative and answered some of your questions. Our intention is to do a video like this every week on Friday. Now I say that with some trepidation because things can change, plans can change, and if we get a surge of coronavirus patients, we may not have time to do this. So we're planning on the next one April 10th. Thank you and goodbye.